One of the biggest questions I hear in healthcare spaces is this: what if a patient brings up faith, but I don't want to cross that line? It's a valid concern because in clinical care, boundaries matter. We're taught to stay in scope to protect autonomy and to never impose our beliefs on someone else, and that's absolutely right. But here's what I want to say. You can hold space for someone's faith without crossing any ethical lines. In fact, when done well, it's not only appropriate, it's healing. Let's start with this. Holding space doesn't mean preaching. It doesn't mean quoting scripture, offering religious opinions, or trying to convert anyone. It means listening with respect. It means making room for what's sacred to the patient, even if it's not sacred to you. When a patient says, "I'm praying for a miracle," you don't have to respond with certainty or skepticism. You can say, "I hear how important your faith is to you. Would you like to talk more about that?" That's honoring and that's safe. That's clinical and compassionate. Faith comes in many forms: organized religion, quiet spirituality, cultural tradition, or a deep personal belief. And for many patients, their faith is how they make sense of their suffering. It's how they cope. It's how they feel seen, and ignoring it doesn't make the moment neutral. It makes it empty. Here's what holding space for faith can sound like. Would you like me to contact a chaplain for you? Is there a spiritual practice that brings you peace right now? How can we support what's meaningful to you during this time? You don't need to answer theological questions. You don't need to solve spiritual tension. You just need to let them know that their faith is welcome here. Respecting faith in healthcare isn't about being religious. It's about being responsive. And the boundary is simple. Never assume belief. Never insert your own beliefs, but always honor the patient's belief when it's offered. If you're unsure, call a chaplain. We're trained to navigate spiritual complexity and support ethically. You don't have to carry that weight alone, because here's the truth: faith doesn't always need to be shared to be respected. And when a person's soul is at the surface, your silence, your respect, and your care can be the most sacred thing you can offer. This work we do, it's holy. Not because of any particular religion, but because we, you and I, the clinician and the chaplain, are entrusted with people's deepest fears, hopes, and questions. And when we honor that space without taking it over, we practice some of the truest compassion there is. I'm Dr. Peggi Trusty, and this is where faith meets medicine. Stay rooted, stay ready, and stay well.